Hey, what's going on, everybody? Kenny Lamons here with Medicare Millennials, where, of course, we chronicle our journey to building a large, successful Medicare book of business. I'm going to take you guys along for the ride, try to help answer your questions, and just provide a little bit of guidance for how this journey is going for us so it can translate to you. And today, as Medicare annual enrollment period rapidly approaches, I've been getting more and more questions on should I focus on selling HMOs or PPOs when I'm doing a Medicare Advantage presentation? And that's a very good question. And if you're new, I completely understand why you would ask that question. But I'd like to shed a little bit of light on why that's not maybe the right way to ask the question. Okay, so this is going to be really good not only for newer agents, but maybe for agents who are expanding into the Medicare Advantage plan market and you're used to only selling Medicare supplements where you would never even think to ask a question like that. Okay, so first of all, let's just break down real briefly what's just this may not be the Webster or CMS dictionary version of what these two things mean, but let me just explain in layman's terms the difference between an HMO and a PPO. So with an HMO, that stands for Health Maintenance Organization, and you're going to have a more constricted network, and that network is you don't have in and out of network benefits, typically speaking. In an HMO, you've got to stay within a defined network. Now, on Medicare Advantage plans, those HMOs are going to provide coverage for emergency situations, but for any general routine care that is not urgent or an emergency, you have to stay in network or it will not pay for that care in any way. Okay, so you also typically must select a primary care physician, and you typically need to get a referral if you want to go see a specialist. Okay, so just think about that. That's a tight-knit group of health providers. You're going to go through your primary care doctor first, and you're going to get referrals before you go marching off to see a bunch of different specialists or get different specialized tests done. Okay, so it's a bit more restrictive in that way, and that may sound like a con, but let me just define it that way for a moment, and we'll come back to it. Then we have a PPO, okay, which is a preferred provider organization. And what a PPO is you have both in-network and out-of-network benefits, okay? But you're going to get, if you go with the preferred or the in-network providers, you're going to get preferred pricing. Your copays are typically lower, your max out of pocket is lower, maybe there's no deductible in network, but there may be one out of network. But if you are traveling or routinely going somewhere outside of network, you do still have benefits and coverage outside of that network. Now, obviously, if you're not planning to stay in network, you might need to, that's going to impact your decisions. You don't always want to be paying out of network copays or hitting that out of network max out of pocket. So, but a PPO, you don't necessarily have to select a primary care physician, and you don't necessarily need to get referrals to go see a doctor, whether they're in or out of network. You don't need a referral typically. So that's the general difference between the two, and they both have their pros and cons. But the question that I posed at the beginning was, should I focus on selling HMOs or PPOs? And there are a lot of agents out there that'll swear by one or the other, and they'll, pretty much maybe never offer the alternative. And that's a big mistake, guys. There's just so many varying needs out there. So the best way I can answer it is this. This has just been my experience. If somebody has been seeing the same primary care doctor and has a super good relationship with like a specific network of doctors or maybe a specific provider network in their local area, and they've been using them and trust them, especially the primary care doc, for a number of years, then a lot of time an HMO can be really beneficial to them. Because you'll often hear people say, I don't care if I have to get a referral. I always go where my doctor recommends anyway. So they're used to they're never going to try to go pick a doctor on their own. They're always going to go through that network of providers, specifically that primary care doctor. So for that type of person, if they're willing to work within the confines of that HMO and get those referrals and stay in network, almost always what we see is that an HMO, especially when it comes to Medicare Advantage plans, has the benefit to that is there's often lower copays, lower max out of pockets, $0 monthly premiums or at least low monthly premiums, and oftentimes some really good rich extra benefits to go along with your plan that they might not offer on their PPO. such as maybe some better dental benefit, hearing benefits, transportation, among other things. So it's simple. If you're, well, it's not always the simple, but the simple answer is you've got to fit it to their needs. If they have no issue with the referral, they do not travel, they would never use a provider outside of the network unless it was an emergency, and they're very cost sensitive and price sensitive, and they're maybe low income, not quite on Medicaid, but they're low income, then and they're interested in those additional benefits, like all of those things, right? So they don't have a problem being confined to that network. They are very price sensitive. They're interested in those any additional benefits or extra help that they can get. Then an HMO may be great for them. Alternatively, if somebody does travel more frequently, or they just do, because you can simply ask, does it bother you to get a referral? Is it common that you would ever go out of network, or would you only work with your primary care doctor? And a lot of times people are like, no, I do not want to go through the hassle of having to get a referral. All it does is slow things down, make things more difficult. And they're aware that their copays may be a little bit higher, especially if they go out of network, then the PPO may be the better option for them. So what do they value? Do they value flexibility, right? And this is where a needs assessment and a genuine conversation with your prospect happens. Or do they value above all else just having the lowest copays, the lowest premiums, and the most extra benefits? And then you've got to help them navigate how PPO provides the flexibility, but an HMO, if they're willing to work within that network, often provides the lowest cost. So none of this is hard and fast. There's always one-off situations, but if you're new to exploring the Medicare Advantage market, it's not so straightforward and simple as the Medicare supplement market as far as which doctors and providers you can see. So I hope this is helpful to you guys, just from a high-level overview of should you need to just understand what HMO and PPO, what the differences are, and how that one is not always better than the other, but it may be better for your client-specific situation. Hope that was helpful, guys. You guys have a wonderful last few days before things get crazy on the 15th, and we will talk to you soon.